In the intricate universe of health, a condition that raises global concerns is diabetes mellitus. This chronic disease affects millions of people worldwide, challenging not only diagnosed individuals but also healthcare professionals and researchers in search of comprehensive answers. The complexity of diabetes manifests in its variety, with types 1 and 2, along with gestational diabetes, outlining a multifaceted landscape. Behind this condition are intricate genetic interactions, environmental factors, and lifestyles, which, when deciphered, reveal a fascinating story of autoimmunity, insulin resistance, and remarkable scientific discoveries. This detailed exploration seeks to shed light on the intricate mechanisms governing diabetes, highlighting its diverse causes and curious nuances, offering a holistic view of a condition that continues to challenge medical understanding and inspire the pursuit of innovative solutions. 1. Type 1 diabetes. Type 1 diabetes is an autoimmune condition in which the immune system mistakenly attacks the beta cells in the pancreas responsible for insulin production. Insulin is vital for allowing cells to absorb glucose from the blood. Lack of insulin leads to an accumulation of glucose in the blood, causing hyperglycemia. This type of diabetes often develops rapidly, usually in children or adolescents, requiring insulin treatment from diagnosis. Autoimmune cause. The autoimmune process leading to beta cell destruction is not fully understood. Genetic and environmental factors are believed to play a role, triggering an immune response resulting in the pancreas losing its ability to produce insulin. Genetics and susceptibility. Genetic predisposition is a key factor. Having first-degree relatives with type 1 diabetes increases the risk, but not all genetically predisposed individuals develop the condition. This suggests that environmental factors, such as viral infections, may play a triggering role. Sudden onset. Symptoms of type 1 diabetes, like excessive thirst, frequent urination, intense hunger, and unexplained weight loss, usually develop rapidly, often within weeks. Early diagnosis and insulin treatment are crucial to avoid complications. Let's see now, the type 2 diabetes. But before, if you are looking for a personalized diet plan, I will leave in the fixed comments the link of custom keto diet. I'm sure it will help you. 2. Type 2 diabetes. Type 2 diabetes is characterized by insulin resistance and inadequate insulin production by the pancreas. This type of diabetes is strongly associated with lifestyle factors such as obesity and lack of physical activity, but also has a significant genetic component. Insulin resistance. In the early stages of type 2 diabetes, body cells do not effectively respond to insulin, even when present at normal or elevated levels. This leads to an increase in blood glucose levels. Insufficient insulin production. As insulin resistance progresses, the pancreas attempts to compensate by producing more insulin. However, over time, the pancreas's ability to produce insulin may decrease, contributing to elevated blood glucose levels. Genetics and hereditary factors. Genetic predisposition plays a crucial role, but lifestyle is also crucial. Having first-degree relatives with type 2 diabetes significantly increases the risk, but obesity and lack of physical activity are significant determining factors. Lifestyle factors. Obesity, especially abdominal fat, is strongly associated with type 2 diabetes. Excess weight contributes to insulin resistance. Lack of physical activity and a diet rich in sugars and fats also significantly increase the risk. 3. Gestational diabetes. Gestational diabetes occurs during pregnancy due to specific hormonal changes leading to a temporary increase in insulin resistance. This can affect the health of both the mother and the baby. Hormonal changes in pregnancy. During pregnancy, the placenta produces hormones that, in normal amounts, aid in fetal development. However, these hormones can also block insulin action, resulting in temporary insulin resistance. Complications for mother and baby. Gestational diabetes can increase the risk of complications such as high blood pressure and type 2 diabetes for the mother. For the baby, it can lead to excessive growth, increasing the risk of complications during delivery and the development of diabetes later in life. Monitoring and treatment. Careful monitoring of glucose levels during pregnancy is crucial. Lifestyle changes, such as a balanced diet and physical activity, are often recommended. In some cases, insulin administration may be necessary to control glucose levels. For other less common causes, while type 1 and type 2 diabetes, along with gestational diabetes, are the most common types, there are other less frequent causes of diabetes. Pancreatic conditions. Diseases directly affecting the pancreas, such as chronic pancreatitis or pancreatic cancer, can compromise insulin production, leading to diabetes. Medications. Certain medications, like corticosteroids and diuretics, can interfere with blood glucose balance, contributing to diabetes development. Genetic syndromes. Some genetic syndromes, like Wolfram syndrome and Turner syndrome, are associated with an increased risk of diabetes due to specific genetic anomalies. 5. Risk factors. In addition to the specific causes of each type of diabetes, various risk factors influence the likelihood of developing the condition. Age. The risk of diabetes increases with age, especially after 45 years. Natural aging of the pancreas and changes in metabolism may contribute to this. Obesity, excess weight, especially visceral fat, is strongly associated with diabetes. Abdominal fat is particularly prone to triggering insulin resistance. Family history. Having first-degree relatives with type 2 diabetes significantly increases the risk. Genetic transmission plays a crucial role, especially in this type of diabetes. Ethnicity. African descendants, Hispanics, Asians, and Native Americans have a more pronounced genetic predisposition to diabetes. This may be linked to specific genetic variations in these populations. Previous gestational diabetes. Women who had gestational diabetes in previous pregnancies have an increased risk of developing type 2 diabetes later in life, emphasizing the importance of post-pregnancy monitoring. Final considerations. Understanding the complexities of different forms of diabetes and the factors contributing to its development is crucial for effective management. Prevention, early diagnosis, and personalized treatment are essential for controlling the disease and preventing long-term complications. A multidisciplinary approach, including education, lifestyle changes, regular monitoring, and when necessary, medication interventions, is crucial for improving the quality of life for people with diabetes. Now, let's look at what some research indicates about the causes of diabetes. 1. Direct study. The DIRECT, Diabetes Remission Clinical Trial, investigated the reversal of type 2 diabetes through an intensive weight loss approach. Results highlighted the relationship between obesity and type 2 diabetes, emphasizing the importance of weight management. 2. Intestinal microbiome research. Various studies explored the influence of the intestinal microbiome on glucose metabolism regulation. Research indicates that changes in microbiome composition and function may be associated with diabetes development. 3. Look-Ahead study. The Look-Ahead Action for Health in Diabetes study evaluated the effects of intensive weight loss and physical activity in adults with type 2 diabetes. Results suggested that lifestyle interventions can have significant impacts on disease management. 4. Diabetes genetics research. Several genetic studies, including the Diagram Consortium, identified various genetic variants associated with type 2 diabetes. These studies highlight the genetic complexity of the condition. 5. TEDdy study, the environmental determinants of diabetes in the young. The TEDdy study investigates environmental and genetic factors contributing to the development of type 1 diabetes in children. Research has focused on identifying potential environmental triggers, such as virus exposure and food introduction. 6. Insulin resistance and inflammation research. Studies have explored the interactions between insulin resistance, chronic inflammation, and type 2 diabetes. Research indicates that systemic inflammation may play a significant role in disease progression. 7. Today's study, treatment options for type 2 diabetes in adolescents and youth. This study investigated treatment options for type 2 diabetes in adolescents. Results highlighted the importance of individualized treatment, considering factors such as age, ethnicity, and disease severity. 8. Adipocyte dysfunction research. Studies have explored how dysfunction of fat cells, adipocytes, can contribute to insulin resistance. This line of research seeks to understand the role of adipokines in metabolic regulation. 9. Accord study, action to control cardiovascular risk in diabetes. The Accord study evaluated intensive glycemic control strategies in adults with type 2 diabetes. Results provided insights into the benefits and risks associated with strict glycemic control. 10. Environmental pollutant exposure research. Epidemiological studies have investigated the relationship between exposure to environmental pollutants, such as air pollutants, and the risk of developing diabetes. These studies explore the role of environmental factors in metabolic health. While exploring these studies, it's essential to check updated sources for the latest information and understand ongoing advances in understanding the causes of diabetes.